What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. And I'm the regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Welcome to Exposé. Today I'm your regular host, Tony Akinyemi, brought to you by the Shepherd's Flock International Church. Last week we started having this interview with Professor Kayode Adedapo of UCH Ibadan, University College Hospital, Ibadan. And we started talking about integrative oncology. Don't forget that the broad topic we're looking at is medical systems. And we've talked to practitioners in homeopathy, naturopathy, osteopathy, herbal medicine, and what have you. Today we're talking to someone who is an allopathic doctor, a conventional doctor, an orthodox doctor, but who has gained expertise and experience in integrative medicine. That is, fusing together the best of two worlds, so to speak. And we started last week by looking at different aspects of oncology that a patient can derive benefits from, apart from the traditional surgery, chemotherapy, radiotherapy. There are other things that can also be done for a cancer patient in particular in integrative medicine that is going to improve the outcome, is going to improve the quality of life that the patient has during treatment, and it's also going to improve the quality of life of that patient even after treatment, and also reduce the incidence of recurrence after the person has been treated. And we are honored to have back again with us on Exposé today Professor Kayode Adedapo. You are welcome, sir.
Thank you very much, sir. My pleasure.
Yeah. Today I want us to go straight away into discussing the different models, treatment models in integrative oncology. Can you start us out with that?
Thank you very much, sir, once again for bringing me on to Exposé. Mm-hmm. You remember we talked about making a diagnosis.
That's right.
After history taking.
Mm-hmm.
And I showed you that the blood picture actually will show a disease state in which the immune system is partially paralyzed and the white blood cells are immobilized.
Right.
So the first thing that is done in the center where I train is called detoxification.
Okay.
Now, detoxification has different means of achieving it.
Mm-hmm.
But the first one I will mention is called oncothermia or oncotherapy or hyperthermia.
Okay.
You recall that when we have malaria, it is accompanied by a fever.
Yeah.
Now, the fever is not inherently bad. The fever was to do a number of things. To produce a conducive environment where the immune systems can be mobile, mobilized to attack the malaria parasite.
Okay.
And the fever that the body also generates, sometimes, because the body does not immediately know whether it is caused by viruses or bacteria, when the temperature, the core temperature is raised, the fever could also kill some parasites and bacteria.
I see.
So based on this knowledge, oncothermia is carried out. And what is oncothermia? It's a procedure whereby the core temperature of the person that is sick is raised to about 39.8, sometimes up to 40 degrees C.
Right.
The normal body temperature is up to about 37.4, up to 37.5, something like that. But in oncothermia, we raise the core temperature well above that.
How do you achieve that? How do you raise that body temperature?
I'm going to explain, sir.
All right.
There is a machine that is used for that, and it uses infrared rays.
Okay.
What the machine does is like a bath.
Okay.
The normal bath we have at home.
Right.
It has a flat bed on it. In the hollow of the bath is the infrared equipment, or what I call the kind of wiring that produces the infrared rays.
Right.
So what it does is that you lie on that naked in that chamber. You are covered with a light cloth. A rectal thermometer is passed to monitor the core temperature.
Okay.
And then that individual is given infusion of IV vitamin C, maybe about 500 milligram. The concentration is usually between 500 and 1,000 milligram. That is going slowly, and you are lying there. A nurse is sitting at your head position, damping your head as the temperature increases.
Why is that done? Why is the dampening of the head done?
Now, because you will be sweating.
Okay.
And we don't want the sweat to go into your eyes, to go into your mouth, because it's toxin that you are removing.
Okay.
So there is a nurse there who sits at the head and is damping, puts a wet towel on your forehead and is removing the one that is coming to your face.
Okay.
But underneath the chamber, the diaphoresis that is elicited, the water is collected. And in some individual, you see the color of the first sweat that is produced. Very, very dark and unhealthy.
Oh my.
Maybe for some others, it may not be that dark, but depending on the degree of illness of that individual, what this oncothermia does, and it is done for about an hour, and the temperature is monitored.
Okay.
There is a calibrator that tells you what temperature is achieved through that rectal thermometer.
Okay.
And so the individual is also allowed sip of water, because he's losing fluid.
Yeah.
And there is dehydration.
Yeah.
So we don't want the person to collapse under the heat. So it's a monitored procedure, and it is entirely safe.
Right.
This oncothermia does about 7 things that I will list out.
Wow.
Number 1, it causes forced dilation of blood vessels.
Okay.
And so it allows white cell to be able to move out, go into the tissue, especially in solid cancers.
Right.
They are mobilized and they are able to move freely.
Right.
And the blood picture that we have seen before, when an individual has been under hypothermia for 1 hour, and thereafter the blood is collected and is repeated, you will see the once clumped together red cell, the fibrin product, and all the immobile white cells are now freely mobile. I wish I can show you a picture, right? Because I have the picture. If I can share my slide, I can show. But then, that's number 1.
Right.
It causes dilation of blood vessels. Number 2, that process of raising the core temperature stimulates, juggles the immune system.
Right.
So, like I said, the white cells are able to move, and it takes a contact between the abnormal cells or the toxins and the white cells to create an immune repertoire, which the body can now process.
Right.
That's number 2. Number 3, hypothermia itself is an inflammatory procedure.
Okay.
I told you that in the sick person, there is low-grade inflammation, there is chronic inflammation. Inflammation is the process that is meant to be short just to protect the body.
Right.
But when it goes on for a long time and you give the person hypothermia, you sort of truncate the prolonged inflammation.
That's right.
So it shortens and it becomes an inflammatory procedure. Number 4, it increases cell perfusion because it is the core temperature that is raised.
Right.
Even areas of the body that has been having low oxygen tension, because they are now opened up, they can receive increased
oxygen supply,
oxygen perfusion.
Right.
Number 5, it stimulates serotonin production.
Right.
Serotonin is an antidepressant. You know, when a person has been sick for a long time, he cannot enjoy his life. Things are looking gloomy. He might have even been told to prepare his will. But once you give hypothermia, serotonin is produced, and then the person is, juggled out of that state of depression. He begins to see hope,
right,
because of the antidepressant serotonin that has been produced. Number 6, it is known that once this has been done, there is the ability of the body to respond to even chemotherapy that is conventionally used. But in this case, you need just about 40%
of the regular
dose that is calculated for that individual. Number 7, hypothermia encourages apoptosis, especially for cancer cells. Once cancer cells are heated, they are not happy because you have changed the environment about them. So some of the cells begin to go into apoptotic change. That is programmed cell death. They die off.
Right.
And so you are attacking the cancer in many ways. And number 5, the infrared rays itself is known to cause killing of bacteria and viruses, which thrive under the environment we have described earlier on.
Right.
So all these 8 things are done just by 1 hour of hypothermia, increasing the body temperature to about 39.7, 39.8 degrees.
Wow, can you imagine? And this is just one out of many therapies.
Out of many.
Oh wow! If a cancer patient comes and is bombarded left, right, and center with the different things, definitely there is hope. Now, I want to ask you this: why is it that in conventional medicine this simple thing you have described is not being deployed? Why?
Sir, you will be shocked if I tell you there are close to 600 literature on the subject of hypothermia, scientific literature.
Right.
And it's just that because of the source of this training that we've always had, the conventional, the allopathic medicine.
Right.
Those who are behind it do not want, I would say, are not really very interested in you breaking their commercial hold.
Oh my God.
The therapy avenues.
Oh my God.
So when you want to introduce something that is not mainstream, what they have taught you, what will make the big pharma to smile, they are not happy with it.
This is coming from a professor of medicine.
I'm very sincere, sincerely, sir. I have all the literature, and I share some of them with you at that time.
Oh my God. I wish we could have, centers, teaching hospitals deploying these very natural, simple approaches, almost harmless, to achieve these ends. Just like that, without deploying, chemicals or being invasive or whatever. I mean, just draining out bad things from the body.
Yes, from the body.
That itself keeps the internal environment cleaner. And the cleaner, the better for the individual at the end of the day. Exactly. I also read about, or saw rather, a video of a university in California, USA, where they actually also installed a hyperbaric oxygen therapy chamber, where people can sit inside the chamber. Is that also available at the center where you intend? Hyperbaric oxygen therapy.
What we call that is not directly that, but we do what we call ozone therapy.
Okay.
The reduced oxygen tension environment in which the cells the vessels are, clamped. They are vasoconstricted. That is, how do I explain that? They are contracted.
Yeah.
Now, so oxygen delivery
is poor.
At the microvasculature is reduced.
Right.
So when you take about 200 mils of blood from that individual, you oxygenate it by ozone, which is oxygen with 3 molecules.
Right.
Oxygen,
Right.
And then you put it back into the system. That hyperbaric oxygen environment saturates or circulates and helps the saturation level of oxygen.
Right.
And under that environment, cancer cells are not happy. Because as you know, sir, they thrive under low oxygen level,
hypoxia.
That's where they are happy.
Yeah.
But once you give them oxygen, just like when a person exercises and breathes in fresh oxygen, you are actually preventing cancer cells from multiplying.
Wow. So right now you've touched on oncothermia, otherwise also known as hyperthermia.
Hyperthermia.
Right.
Yes.
Now you've also talked now about ozone therapy, which is an indirect way of boosting the amount of oxygen available to the cells in the body. Then you mentioned the substance fibrin the other time.
Yes.
I was reading a literature the other day that talked about fibrin's role in cancer metastasis. How fibrin plays a big role in making cancer to spread to other parts. That when a cell breaks from a primary cancer tumor into the bloodstream, it actually uses fibrin to glue itself to the secondary location where it begins to grow. That if fibrin level goes down, it also reduces the incidence of metastasis. What do you have to say? What are your thoughts on that?
Yes, sir. You know, remember I said that it's just that maybe at another forum. That class.
You definitely want to come for part 3. Okay,
let me quickly rush it.
Right.
What happens is that once you give hyperthermia and the white cells are able to move, you have what we call either the neutrophils.
You're right.
Okay? They are energized and they can ingest these fibrin degradation products and clear the system.
Okay.
That's their work. But because they have been immobilized previously, and that is the system that operates for a long time. Cancer will easily spread under that condition. But once you you energize the immune system by hyperthermia, and all these cells are free to move. We have neutrophils, we have basophils, we have eosinophils. All of them are moving, are mobile, and they are able to ingest all these products and destroy them or present them to the immune system. Then the system will be healthier than if you didn't go through hyperthermia. Well,
thank you, sir. So we have looked at hyperthermia. We've looked at ozone therapy. We've looked at detoxification, as it were.
There are some other means of detoxification.
Good. That's exactly
like you already know, sir.
Where I was going to go to. Why not touch briefly on those?
Okay. Like, sir, that we can also use supplements to detoxify.
Right.
I know that in your supplement armory, just like the one I also believe in and participate in, the Pure, we have what we call the cleanse. The cleanse is a mixture of several herbal plants, including what is called Sagedia. Now, these plants are able to detoxify. Yes, they are able to detoxify the skin, the liver, the kidney, the GI, the lungs. It's called the cleanse. And that cleanse is a combination of herbal products. And when you take 2 tablets in the morning or 2 tablets at night, when you wake up in the morning, it's able to just move away all the undigested products that is in the system. And it cleanses the liver, it cleanses the kidney in the same process because it is first introduced into the blood. It circulates the entire body before it comes back to be excreted.
Right.
Now, what that does is that it helps in detoxification. We also have a Pure XL, which is a combination of 2 powerful antioxidants, glutathione peroxidase and superoxide dismutase. These 2 compounds are very useful in detoxification. Whereas when I went there, we use a lot of herbal teas.
Right.
There are herbal teas, particularly for the liver. There are those for the GI. There are those for the kidney. And so each day of the week, these herbal teas are served.
Okay.
So if you are admitted there, you take different herbal teas on different days of the week. And typically, a patient will stay there 2 weeks, maximum 3 weeks. Their lifestyle is changed and they can go home. So Apart from oncothermia, we have herbal teas, we have supplements, different kinds of supplements that are used for this purpose. And I've mentioned when I came back was when I joined the Pure Product team. We have Cleanse and we have Pure Excel, which contains those antioxidants that I mentioned. Of course, you know sauna bath
Right.
is also a means of detoxification. We also have honey massage.
Okay.
And I witnessed a honey massage in which pure honey is poured on the skin. The person is lying face down. And by the time the massage is finished, the pure honey that is golden yellow become brown, completely dirty, removing all the pores that had been blocked,
Right.
at the back. It's another means of detoxification. And of course, pure, water, what we call that has gone through reverse osmosis. I'm sure you know about that, sir.
Yeah.
The water is purified several times. Right. Reverse osmosis. So when you take pure water, it makes bioavailable water to be available for the cells. And this helps the mitochondria to push out whatever needs to be pushed out. So those are the main detoxification methods that is practiced in that center.
Yeah, you need to clarify that pure water thing so that people don't misunderstand the water in sachet that people drink.
Yeah, no. It goes through several filters. And to get the water is called reverse osmosis.
Yeah.
I'll show you.
Yeah, I understand it. I just don't want people to go away with the impression that once you go to the street in Nigeria to buy pure water in a sachet, maybe we should call it purified water.
That's right.
Because the nomenclature here in Nigeria means a different thing altogether.
Okay. Purified water.
All right. Thank you very much. So I want you to help us this way to articulate in bullet form, point by point. If a cancer patient enters into a clinic where integrative oncology is practiced, what does that patient expect from start to finish? You said in that clinic, for example, they will spend 2 to 3 weeks. During the 3 weeks, I want us to help us itemize all the things that will be needed. That is what you're going to do when we come back from break. We are going on a short break now. Itemize, when the patient comes, we will do number 1, number 2, number 3, number 4, number 5. By the time the 3 weeks are over, that person will have gone through all of this at the end of the day. So we're going to go on a short break. Don't go away. This is Exposé brought to you by the Shepherd's Flock International Church. And don't forget, what we need is not more medication, but more education. And the best prescription is knowledge. We'll be back very shortly.
My name is Mrs. Damilola Olabimayowa. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, and years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine. My kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that is to take me to know everything I need to know to details about this elder living.
Welcome back.
Thank you.
This is Exposé, brought to you by the Shepherd's Flock International Church, and we have today on set Professor Kayode Adedapo of UCH, Ibadan University College Hospital. Is a teaching hospital, one of the foremost teaching hospitals in the Commonwealth, and particularly in Nigeria. And he's a professor, associate professor of chemical pathology. He's also an expert in nuclear medicine, and he has also trained in integrative therapy. And today he's discussing integrative oncology. He's going to outline for us what a cancer patient should expect should that patient find himself or herself in an integrative medical clinic from day one till the therapy is over. Over to you, sir.
Thank you, sir. The first thing that happens is that you are welcome to the center and you will come for consultation. It's at consultation that the diagnosis of your peripheral blood smear is done. And thereafter, you are ushered into a room where you will be staying. And the room does not have TV because when you are sick, you are not allowed to, still bombard yourself with different kind of news.
Negative news.
Negative news that is going on. And that brings me to the next thing that is done. It is called psycho-oncology.
Wow.
Psycho-oncology is a branch of integrative cancer care wherein all the negative emotions, the negative predictions, the negative news that you have received or conditions that you have been in that have brought you to that case or that situation of being ill, especially with chronic illness like cancer or chronic fatigue syndrome. It is the ability of the carer to unearth things that you have subsumed over the years, which you don't even know you are reacting to.
Right.
You will be asked if you have an insight into how you got to where you are. And then it is demonstrated to you to know that you are the custodian of your own body environment.
Mm-hmm.
We demonstrate that by putting you in a field. If somebody is coming across to you and is bringing a sharp object, there is a level that person gets to and you restrict the person from coming further.
Mm-hmm.
Because coming further will mean that the sharp object the person is holding will penetrate you.
Mm-hmm.
So psycho-oncology is essentially telling you that God has given you your body and you are totally in charge of what you allow in.
Right.
And what you don't want.
Right.
Nobody can tell you that you cannot recover because this body has been given to you.
Mm-hmm.
So it is an attempt to reprogram your mind.
Right.
To believe that even in the particular situation you are, healing is possible.
Wow.
And from there, psychotherapy goes on about every third day, every three days to find out what you are now thinking, whether you are thinking better now than before, when you came in.
Right.
And to also help this, we have a lot of visuals. You read books of people who have had radical remissions in course of their cancer therapy. You read book about radical forgiveness. There is a place that is allowed for you to visit where you can read all these works, where you can read people's books, where you can watch dedicated video of people giving testimonies of how they were when they came into the center and 6 weeks down the line, what they felt like. So when you hear the testimonies of others, you are encouraged. All this is in the view of psycho-oncology. Thereafter, depending on the program that is planned for you, the next thing is you are introduced to the cafeteria.
Right.
It's in the cafeteria that you are made to know that your food is going to be largely ketogenic. And ketogenic diet discourages a lot of high carbohydrate diet.
Right.
Ketogenic diet is programmed after that of Otto Warburg, that German physician, who first proposed that cancer feed on carbohydrates, feeds on glucose. We know, sir, that a typical cancer cell has about 16 times more receptors for glucose than ordinary cells.
Right.
So if you continue to eat high carbohydrate that is turned to sugar, simple sugars, this cancer cell will have an atmosphere to continue to thrive.
Right.
So they are deprived of that rich carbohydrate environment. They take largely fresh fish together with very low carbohydrates and other food that we regard to as largely ketogenic.
Healthy fats.
High protein, high fat, but low carbohydrates.
Right.
Now that is to allow the cancer cells to go into remission. And you spoke about IPT.
Right.
IPT is also based on that principle. If I may just lump it before I come back to what goes on with this individual. Yeah. IPT is also a knowledge of the fact that cancer cells are, reservoir of glucose uptake cells. They have receptors more than ever for glucose in their surface.
Right.
So, Otto Warburg, who also mentioned this IPT, that's insulin potentiation therapy.
Right.
What this treatment is all about is that you give a calculated insulin dose by infusion for this patient, and you are monitoring the blood glucose.
Sugar, yeah.
So you monitor the blood glucose till it is below 40 milligram per DL.
Okay.
Hypoglycemia starts about 45.
Right.
But under control, as you are infusing insulin, you are also taking, every 10 minutes or 15 minutes, you are monitoring the blood glucose. And once it is at about 45, for instance, you now give about maybe half the dose of the conventional chemotherapy that you're supposed to give. And the insulin is discontinued, and the person is now given either a high glucose juice, from fruits, so that the hypoglycemic environment
can be changed,
reversed.
Right.
What it does is that the moment the chemo is given, these receptors are already open to receive whatever is coming into the body system through the blood. And so they will swallow the entire 40% of the reduced chemo that is given.
Right.
And they will close down. So when the person is now being refreshed, they are not able to take in as much of that glucose, which now goes to nurture the normal cells.
Right.
And that effects a faster cancer cure than when you give a full dose of chemo under a condition that is already stressed. There is high cortisol, there is hyperinsulinemia, there is all kinds of things going on. So that is IPT just in a nutshell. Can
I cut in here, sir? Can I cut in a bit? Please maintain your line of thought. I don't want to lose that track. I don't want us to lose that track. Just help us maintain a track. Yeah, but I just want to cut in a little bit. I remember about 15 years ago, I was talking to a medical doctor, a conventional medical doctor in a teaching hospital here in Lagos about IPT. And he said he had never heard it before. And I said, wait a minute, I'm a layman. and I know about IPT. How come you're a consultant in the teaching hospital? You've never heard about IPT? What is going on? Particularly when you are involved, when you're an oncologist, you never heard. Is it that IPT is not part of the curriculum in our training here in Western medicine in this part of the world? That's number one. Then number two is that in IPT, the whole idea is to make the cancer cells that are much greedier, as it were, because of the many receptor cells they have, to suck in all the chemotherapy drug that goes in, rather than the rest of the body, being damaged by that medication. Then you also talked about putting chemotherapy into an environment that is already deranged, as it were, which means that if somebody's body is already fully toxic, the person is already poorly oxygenated, the body is already going through serious inflammation, the body is already acidic, and all of those parameters are out of order, and then you put chemotherapy, full dose chemotherapy into that person's body, it is not likely going to do a good job. in that person's
No.
body. So which means by the time you, first of all, regulate the environment and you now do this regulated dose, there is less harm and there is much good that is achieved. Is that correct?
Absolutely. Absolutely.
All right.
That's exactly what I'm trying to say.
Right.
And this is what happens. Yeah.
Right. The question I asked is, why is IPT not included in our
Not
modalities? in
And there have been books, big volumes,
right,
published on these things.
I have one, right? I have one. I mean, on my shelf.
I think you gave me one too.
Right. Yeah.
IPT, big book.
As
like
big
this.
as a Bible on insulin potentiation therapy.
Yes. And it's a publication of different scenarios, different therapeutic approaches that had been successful over the years.
Right.
That were documented. Now, let me share a small occurrence in UCH with you.
Right.
I was in the tumor board.
Right.
And we're talking about management of patients with cancer, the chemo arm, the radio arm, and different kinds of arm, nuclear medicine.
Right.
And I stood up at that meeting and I introduced IPT.
Right.
You will not believe what happened next. One of the surgeons stood up and said, "No, we don't want charlatans here. These are the ways they tell people." He just walked out of that meeting. Wow. The CMAC that was presiding over the meeting
Right.
just apologized profusely. That you are there, you are bringing is international, it is recognized, but maybe he doesn't know of it. But what happened was that well after the meeting, the man came and met me and apologized. His colleagues must have gone to speak to him that why should you react like that?
Right.
What he's saying is something that is documented, is on the internet. You can read about it.
Right.
And I was just saying, since we're a tumor board, we can begin to introduce these things. We have a chemical pathology that can monitor the blood glucose. We can give the insulin from, the physicians, and we can, just prepare parallel studies to measure the outcomes.
Right.
These are things that we can do at our level, but some of them don't want to hear of it. I think it's not that they don't know. They don't just want to consider it because I think some people get benefit from just giving chemo and things like that, but not everybody. I think some are genuinely ignorant, and some who do know because of past experiences of people who left their care and went for alternative therapy,
right.
and they were badly managed. Maybe they got to wrong hands,
right,
and they came back worse.
Right.
Those are scenarios that has discouraged them that, the things you are talking about doesn't work. It just complicates issues for people, and they come back sicker.
Yeah.
So that's what I may say about that.
Yeah, commenting on that, I was just ruminating over a similar scenario. I was discussing with a cancer patient this past week who is receiving care at a teaching hospital somewhere in Nigeria here. And I'm working with her to also support her from my own side, nutritionally and otherwise. And she kept telling me that her oncologist says, look, when you go to these quacks, you are still coming back to us. You go to these quacks, said many of them will go and they are badly managed, and then they end up, by the time they come back, it's already too late. And I said, well, it is those who go to the wrong hands that come back. Those who go to the right hands get well, they don't come back. So you get to see only those who went to the wrong hands. And that is not the totality of what obtains out there. I think a more holistic and global look should be taken to look at all these other options, which one of them works and which of them don't work. Anyway, sorry for the digression. Let's come back on track to what you were itemizing for us. You talked about coming in to have consultation, and then you have live blood analysis, then you have oncotherapy, and you have detoxification, and then please carry on from there.
Yes, I was on the diet. The diet is changed, and this is the diet that you are trained. In fact, you are given literatures on how to continue when you get back home. So you get used to this diet while you are there, and you discover that you begin to improve.
Right.
And the environment where this clinic is situated is so beautifully flowered. It has a beautiful lush garden. So
I can see your background that you have created a similar one.
So it's an environment like this where you have different kind of roses, different kind of flowers under the shade trees. Seats are placed there. There are small, streams and fountains. Now that healing environment is again conducive for them to have their thought process reorganized. They begin to, have good thoughts. The environment with good smell from the flowers, again, contributes to the healing. Now, that is what probably happens on a daily basis. But I still need to quickly itemize 3 other methods of, treatment that also goes on in that center. If you don't mind, I can quickly do.
Go ahead, sir. Go ahead, please. Go ahead.
Yeah. We're just talking right now about how conventional medicine does not accept these things. I remember that a lot of our patients, when they come for their diabetic management, some of them have diabetic foot.
Yeah.
And those ulcers don't heal.
Right.
And that brings me to what we call pulse
PMF.
Pulse electromagnetic therapy. Now, pulse electromagnetic therapy can either be local or whole body.
Okay.
For people with arthritis, the pulse electromagnetic ring is just placed around the limb, either the knee, the arm, the ankle, or wherever they have that.
Right.
And it delivers pulses of magnetic stimulation to that area. And what happens is that it increases the microcirculation in that environment.
Okay.
And because this person has already gone through the process of, oncothermia and the blood, the fluid, oxygen is delivered, and the arthritis and the pain at those joints are relieved. And if it is whole body, you lie on a couch and you're sleeping on the magnetic bed, and then the second pole is placed around your chest, and you are there for about 30, 40 minutes. So people with cancer pains in the different region, by just allowing them to go through this magnetic field, they begin to heal. Another thing that I think it does about 4 things. 1, it increases microcirculation.
Right.
Number 2, it energizes the mitochondria.
Wow.
The mitochondria is the powerhouse of the cell.
Factory.
Yes, and it is there that it regulates pumping out of things that are not useful to the cells.
Right.
It allows things that are useful to the cells to be brought in. So by lying on that magnetic field, your mitochondria become re-energized. And it takes over.
So mitochondrial dysfunction is addressed.
Yes, it's removed. And the third thing is that it reduces the inflammation that has been going on. Because now there is better oxygen supply, the white cells are moving, inflammation begins to abate. And so I thought that our patients at the hospital who have diabetes can just go through this. And their diabetes ulcers will eat faster. I even introduced and did a presentation. But if they are going to buy that machine, it's still going to be probably next year.
We are going to pray they will buy it.
So it's good for people with arthritis, people with chronic fatigue, cancer pains and things like that.
By the way, before you move away from pulse electromagnetic treatment
therapy,
there is Undermed. I'm sure you've heard about Undermed machine before. It's another German technology, which is pulse
15 hours
electromagnetic frequency, pulse electromagnetic PEMF equipment. It has some more, how do I put it now? It's able to even figure out which parts of the body requires attention. So let me say loosely, it can diagnose, and then it is also for therapeutic purposes. In other words, when the body is scanned with the Undermed equipment, I'm not a specialist, I'm not an expert, I just know some peripheral things, because I have interviewed on Exposé before, the brains behind Undermed. Incidentally, it's available in Nigeria now. I hope UCH will acquire one soon. Yeah. Undermed helps a lot in when the body is scanned, it can tell which parts of the body has weaknesses that needs to be stimulated, that needs to be strengthened. And it can also deliver pulses that will also help to strengthen those areas. Some centers in Nigeria have already acquired acquired undermed, by the way. I think Federal Medical Center, BIDA, already has it. And I am aware of 2 locations in Lagos, Nigeria, too, private individuals that also have the undermed. There's a private clinic in Lagos that has undermed. There's another one in Abuja that uses it. Similar to that one, probably a notch higher than the magnetic pulse, whatever. So I just wanted to mention that. Go ahead, sir.
Thank you, sir. That would be nice if our mainstream teaching hospitals can begin to acquire this, because their patient will heal better.
Right.
It's not every patient that needs drugs.
Right.
Some will just, under this physical therapy, can get cured.
Now, you've touched on so many things that, well, I wish we had all the time to have this discussion. For example, you were talking about no television in the room where they put the patient, because you don't want that patient to be bombarded with negative news. Okay, because majorly what you hear on major news networks is negative. If it's not terrorism, it's kidnapping. It's not kidnapping, it's shooting. If not shooting, it's drug, it's gangsterism. It is occultism. It is fraud. It is this or that, rioting, or all kinds of different things, bandits, and that can get a person to continue to go downhill. Somebody who's already challenged in their health, they can go downhill. Now, but the aspect I want to ask you is, why is it that doctors, particularly in conventional medicine, why do they tell patients you have 3 months to live? That kind of piece of news, is it going to be of any help to that patient? I know that they are speaking from their knowledge and their understanding and their experience of the progression of that kind of condition. The disease has been staged, and they know that when a person gets to this stage, typically it will take maybe another 3 months or 6 months, the person is a goner. Okay, but why must we communicate that news to the patient? Is it going to help that patient in any way?
Well, I think, again, it's maybe a response to questions that patients do ask. Okay, they came in towards the terminal stage.
Yeah.
And the diagnostic equipment or results are very grave. All right, so maybe sometimes it is the patient that do ask the questions. How long do I have to live? Can I still, a doctor may be forced at that time to say, give or take, if we look at the rate this thing is progressing, if nothing is done, you may not have less than 6 months to live. I think it's in a way of being frank with their patient, not probably saying, go home and use the 6 months to die. I don't think that's what we do. We're only trying to be factual that you need to do something about it, but the stage at which you have come is so late that very little can be done. Not taking into cognizance that it's a multi-metabolic disease. And all other approaches need to be utilized.
Yeah, you see, because I had a lady a Nigerian who went to England and was, I think it was pancreatic cancer, and they actually opened her up. They wanted to do surgery. They found out it was inoperable. They just closed her. They just closed her up and told her, well, the only thing we can offer you is chemotherapy right now. And they said to her, point blank, if we don't give you chemo, you have 6 months to live. If we give you chemo, we might expand your lifespan by another 12 months. So the lady felt
a miserable life.
You want to give me 12 months of miserable life for 12 months? I'd rather go in 6 months' time than do the 12 months miserable life. She returned to Nigeria without taking the chemo, and it was after that she came to see me, and we placed her on dietary change, gave her all kinds of different stuff, and she was able to go back to work, and she lived for another 2 years. She finally passed, but she lived for another 2 years. And 2 years? Yeah, two good years with pancreatic cancer. 2 years. And
that's the feat.
And it was high quality life. She was able to return to work during that period before the thing relapsed, and then she didn't make it at the end of that. But, that's one. Then you also talked about food. You talked about ketogenic and blah, blah, blah. 2 things I want you to touch upon here before we round up. Our time is really up, but I know our viewers will bear with us. One is you are talking about food, nutrition as a major factor in the whole package for integrative oncology. Meanwhile, I have also met cancer patients who come to me. I'm a nutritional consultant. I'm not a doctor. I have met cancer patients who come to me for nutritional counseling, and I am trying to guide them with their nutrition. And they tell me, but my oncologist told me I can eat anything. I mean, I keep wondering, why is it that conventional oncologists don't think that diet plays any major role in this whole equation? They seem to believe that it's just the chemo, the surgery, and the radiation, and nothing else. I believe these things can be well integrated. That is one.
It's sad because when people are even sick, people begin to bring Bonvita, bring milk, sugar, so that the person can, now live better.
Right.
And that's what's worsening the condition.
Right.
I don't know what we're going to do, but now I think nutrition is being incorporated into our medical curriculum.
Good.
And I think that will go a long way to, the generation of doctors that will be coming after us will probably fare better than what we have been programmed to do. Of course, you gave me a book also, Dead Doctors Don't Lie. I mean, when they themselves, what do they eat for break? Coke and biscuits.
Right.
It's what's in their fridge.
Right.
My colleagues are in the theater, they eat buns, they eat pop-off and all these things and wash it down with Coke. And that's the regular lifestyle of probably some surgeons when they're operating. We ourselves are not eating healthy. How then can we, instruct our patients to eat healthy? And when we take fruit, we only take the sweet part. Take, for instance, watermelon. People only take the pink part and throw away the rest. So I think it's going to be a revolution for us to learn new things.
Right.
Like Alvin
Toffler.
Yes. That you have to be able to unlearn, relearn, and learn all things.
Yeah, so that's right.
I think that's what we need, actually.
Yeah, I was reading a report that was suggesting that physicians, doctors in America have a lower life expectancy compared to the average population. And the question is, how can the people who should know best be the ones that are dying earlier, than the average population? Now, finally, on this diet thing, you mentioned ketogenic diet. I know that keto has become one of the raves in town, one of the major fads in town. I mean, in the last 1 decade or so, keto diet became so popular in this part of the world in particular. I mean, I've known about keto diet for quite a while, but in the last 1 decade in Nigeria, it became like a fad diet where everybody say, keto. Oh, I did it. I was weighing 150 kg. Now I'm weighing 75 kg. And now this and this and that. And when I peeped into what people are doing for ketogenic diet in this part, and I found that as a nutritional consultant, I could not accept the things they are consuming on their own keto. So what I have done in my mind is to divide ketogenic diet into two. I have what I call the good keto and the bad keto.
Bad keto, yeah.
Yeah.
Sure.
Now, I see people who are doing keto. I understand the dynamics of how ketogenic diet works. For example, in relation to cancer, you have just mentioned that cancer has 16 times or so more receptors on the cell than regular cell, which means that when glucose enters the bloodstream, cancer cells will gulp it up faster than, maybe 16 times faster than regular cells. Right. So, and cancer cells being primitive cells, they are not fully differentiated. Okay. So they can only use glucose for energy. They cannot use ketone bodies for energy.
That's right.
So when you do ketogenic diet, you are removing the glucose and you are supplying ketones. The brain can use ketone. Fully differentiated cells, regular cells, normal cells can also use ketones for energy. The cancer cells cannot. So indirectly, you are starving the cancer cells. But then when people when people do the keto diet, that they eat bacon, they eat processed meats, they eat very horrible kind of things.
That's very bad.
And they call it keto. I want you to please help us straighten that out. Straighten it out. What are the healthy fats, healthy proteins that come under keto? Not just any junk. Just because it's not carbohydrate does not mean it's healthy. Yes, sir. I want you to help us straighten that out a bit.
Yes, I'm glad you gave a brilliant explanation of the basis of a ketogenic diet. That normal cells especially the highly metabolic one like the brain, can use ketones when there are no glucose.
Right.
Our aim is to starve the cancer cells of readily available glucose.
Right.
We want to give complex carbohydrates, that will take time to release the simple sugars.
Right.
So there, they give complex carbohydrate, very small. They give fresh fish. They give roaming animal, robust, and very small.
Right.
But largely this kind of diet, but they don't give any processed meal. In fact, we are not allowed to sugar. We are not allowed to have any fizzy drink. We are not allowed milk, cow milk.
Okay.
All these are taken away from your diet. So it's just what is sufficient for you to have enough energy to process your day.
Right.
And if you are going to take carbohydrates at all, it is the complex form that takes time to break down and make just enough available for your normal body cells. But the cancer cells are hitherto starved through the mechanism you have spoken about. They normally there is a cafeteria that supplies the food. So those people don't need to bother. They just give what is served, breakfast, lunch, and supper.
Which means that the cafeteria department should be a major department in every hospital.
Yes, especially a cancer clear hospital.
Probably also diabetes and hypertension, Yeah.
Can I share an experience? When we see diabetic patients and we send them to a dietitian, in fact, they almost invariably come back non-controlled.
Wow.
And we will ask them, what kind of food are you eating? Then they will show us all the food that had been given them from the dietitian. And we have to reprogram them ourselves, particularly myself. And that's why my patient love me, because I will tell you how to eat in the morning, what to eat in the afternoon, like the program we went through with you.
Right.
The vegetable salad in the morning, half cooked food in the afternoon, plus vegetable salad, and a quarter of what you have taken, the cooked meal you have taken in the afternoon, at night with vegetable salad. Right. And when I put that to them, for those who can afford it, they come back better. They tell them take pap, but they don't tell them not to take the pap that has been sieved. Right. And all these things are important. This patient needs complex carbohydrates. All they tell them, you eat beans, beans and beans and beans.
And wheat.
Who can survive on beans alone?
Thank you so much, sir. We cannot go any further than here. One more time, I wish that teaching hospitals in Nigeria could set up integrative centers, at least if not for direct therapies to patients, but at least for research for now, to do research and be sure that these things, we want to either prove them right or prove them wrong. I mean, centers like that, I believe, should be set up where we have all these alternative protocols instituted, and volunteers can come there and say, okay, I volunteer myself, I'm a cancer patient, I want to go through this and see whether it helps or not. Or I'm a diabetic patient, I want to go through this, whether it works or not. I believe if we begin to pry into those areas, we can validate or rule out, as the case may be, things that are acceptable, things that are not acceptable. Thank you, Professor Kayode Adedapo, so much for spending your time with us on Exposé to elaborate on all of these very wonderful areas in integrative oncology. We are praying that since we have you here in Nigeria and you are in a teaching hospital, that maybe with your influence, your teaching hospital can set up such a center on the one hand, and you can also probably also consult with private hospitals that are interested in instituting these practices in their own clinics. If they are ready to be tutored by you, mentored by you, to help them set up so that they can start. I mean, what stops a private hospital from having a live blood analysis system in place, oncothermia in place, and all of those things? I believe those who are interested in some of these modalities may want to contact you, and therefore we want you to also give us your contact details one more time today so that people can reach you.
Just before I do that, I want to give it to one of our provosts of the College of Medicine. He was in Ghana and he saw a hospital in Ghana, a teaching hospital, where they allow patients to choose whether they want conventional or they want to go integrated approach. And he was interested in bringing that, but he couldn't complete his term because he was given an appointment by the government. But I believe with time we'll get there and it will be done.
Amen.
Once again, my email is ks@adedapo, K for Kayode, S for Solomon, Adedapo @yahoo.com. And my WhatsApp line, which is also for SMS, is 0806 209 8091.
Thank you very much, Prof. We cannot thank you enough. Please give our warm regards to Madam. By the way, Professor Adedapo's wife is also a professor of medicine, an associate professor of medicine. It's a family of professors of medicine. And I think one of their children is also a physician, I believe.
Thank you, sir. Yes, it is.
We thank God for your life. Thank you for your contribution. Thank you for your impact. Thank you for your influence. We look forward to many more days of your continued service to God and humanity. And I mean, our viewers don't know that you're also a pastor, by the way. We thank God for your life, for everything that you are doing. Thank you so much.
Thank you very much.
And thank you for being with us tonight. So viewers, this is where we draw the curtain today. Thank you. We apologize for overshooting a little bit today, but we believe that every minute has been worth it, because what we need is not more medication, but more education. I believe you have been educated today, again, in another area of medical systems. The best prescription is knowledge. Don't forget to subscribe to our YouTube channel and press the notification bell. Like us on Facebook and follow us on Instagram. And you can view past episodes as well. Thank you for your time. God bless you. Have a terrific week for the rest of this week. Bye-bye.
My name is Mrs. Damilola Make's. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, and years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a comprehensive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine. My kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that it will take me to know everything I need to know to details about this elder living.